It's Dave today coming to you talking about heartburn, indigestion, dyspepsia, reflux. Very common occurrence. In fact, it's one of the most common GI related things that people complain about. There are actually two types of heartburn. One is nocturnal, meaning when you sleep, which for a lot of people it will actually wake you up because you're not able to sleep. You'll get that bad taste, that belchiness during the night that keeps you awake then. Then the other is postprandial, meaning after you eat, especially a meal. The first thing about it is if it's a chronic issue, I want you to get it checked out. If it's occurring every day for more than 2 weeks and you have tried some over-the-counter things and it's not working, you need to get it checked out. Also, if it's occurring off and on, but for longer than a 3-month period, you need to get in and get it checked out, because it could be something more serious that the sooner you find out the better, or it could be something not as serious, but if you don't get treatment started on it, it could become a bigger problem for you. With the seriousness of it, if you're going to continue having the symptoms without getting things treated, some of the things you can look at that it can lead to is some things like Barrett's esophagus, esophagitis, a GI or a stomach bleed. And the American Cancer Association has actually found out through studies that if you have a chronic heartburn problem, it can make you more prone to having throat cancer. So the sooner you get that treated, the better it is. What actually is heartburn? It can be a lot of things. It can be a bitter taste that you get after you eat. It can be bloating, belching, gas, indigestion, a choking, or just a chronic cough that you can't get rid of. You think it might be something upper respiratory. Actually, it's more stomach related with heartburn. Sore throat, hoarseness, or the actual regurgitation that you do get where it burns coming up and it doesn't taste good. Can you self-treat it? Absolutely. There are some things you can do. If you're getting the bloating, you're getting the gas or the belching, you can try things like over-the-counter simethicone, which will generally help out and take away a lot of the problems that you're dealing with there. You also can do something like Tums or Rolaids. Those are generally safe, not very many drug interactions. If you're a female, you can actually get your calcium from the Tums. But the one person that I'm looking out for in that regard is if you're a kidney patient with chronic renal issues, you need to talk to your provider before using those on a chronic basis. Maalox, Gaviscon, the generic antacid liquids, those are safe to use as well. However, if you're on other medications, you will want to separate out those medications from using those liquid Maalox antacid type drugs, because they can actually block the ability of those drugs to absorb, so they're making those drugs ineffective. If you have any questions, talk to your pharmacist about that. They'll be able to sort that out. The other options out there for you are the proton pump inhibitors. So the Nexium, the Prevacid, the Prilosec, that are over the counter now. I do want you to remember there are drug interactions, especially with Plavix or clopidogrel. If you're on clopidogrel, talk to your pharmacist or doctor before trying any of these. Also, those are going to take about 2 to 3 days to actually kick in. You're not going to see full effects right away. So they may not be an option if you want something right away. And again, do not take them for longer than 2 weeks without talking to your doctor or provider, because there are some long-term effects that you can see with that, and it may be a more serious issue than just an over-the-counter treatment that you need to do. Lastly, you can look at the H2 blockers or drugs like famotidine, which is Pepcid. Those are generally going to be dosed at twice a day, not once a day. you want to remember there's also drug interactions with those. If you're on a thyroid medication like Synthroid or levothyroxine or Coumadin or warfarin, you want to talk to your doctor or pharmacist about that. They also interact with several blood pressure medications as well. So talk to your pharmacist before actually using any of the H2 blockers if you're on any medications. There are a lot of cancer treatments that interact with that as well. So if you're going to a specialty pharmacy or having to go through the mail, or you're getting that from your cancer doctor, talk to your oncologist about that before starting famotidine or any H2 blocker. Things to look out for before trying to self-treat yourself, or if this occurs during self-treatment. If you're having any bleeding whatsoever in your vomit or regurgitation, or if you're having any black or tarry stools or blood in your stools or on the toilet paper that you're noticing, if you're having trouble swallowing, if you're losing weight and not trying to, if you're having chronic hoarseness, your voice is just chronic, you cannot talk like you used to be able to talk. Or, like I said earlier, if the problem is a chronic problem off and on for over 3 months or lasting more than 2 weeks, even after trying the over-the-counter things that I've recommended, get in to see your doctor right away. They may want to do a colonoscopy on you or some stool cultures to look for bleeding in your stools. The faster you do that, the better it is for you, the better the outcomes will be for any dangerous situation that may be occurring, like GI bleeds associated possibly with cancer. The earlier we can catch that, the better it is for you. For some non-pharmaceutical related things you can do that may help you out without having to take any medications. First off, lose some weight. That can help. Second, if you're a smoker, stop smoking. If you're a chewer, stop chewing. Also, eat smaller meals, but maybe more throughout the day. So instead of eating 2 or 3 big meals, eat 4 or 5, but make them smaller throughout the day. Healthy snacks throughout the day can also help. Avoid spicy, hot foods. That can really disrupt your stomach. Avoid alcohol. That can cause a problem. Carbonated beverages like pop is the main thing. That can cause a problem. At night, especially if you're having the nocturnal situation where it's keeping you up at night, elevate the head of your bed and sleep on your left side. That also helps with digestion. Something else to consider if you're having a chronic issue with it is try a probiotic. Sometimes a probiotic can help out with that, like Florigen pure encapsulations are 2 that I recommend as well. So those are just some tips that can generally help out, but if you have any questions or issues, notify your doctor. One last thing for especially my females out there. If you're really having a lot of chest pain and it may be radiating down your arm, into your back, into your jaw, you notice any problem breathing with that, call your doctor, get to the ER right away, because it may not be heartburn. With females especially, heart attacks show up and it seems like it's heartburn to start out and goes into a heart attack. I don't want to scare you, but you want to get that checked out.